Good afternoon, dear friends. Let's begin our lectures about children's physical development in different age. Our it's lectures for second year student. Um, and plan of our lectures here. It's criterion of physical development. The second main questions, principle and method of estimation of physical development. And third, semiotics of physical development disturbance and physical training and handling of early age children. First, what is physical development? All our study of any question start from definition. Definition is concentrate information about topic. Physical development is a dynamic process of growth and biological maturation of child during other periods of childhood. Its most big definition of this process. I repeat once more. I'm very happy for your present. Its physical development is dynamic process of growth and biological maturation of child during all periods of childhood. It is increase height and weight, development of different part of body. Height and weight, it's main parameters for physical development, but also different part of body must be used for estimating physical development. Criterion of physical development includes morphologic quality, includes in anthropometric indexes weight, height, head circumference, chest circumference, abdomen maybe also circumference, arm, femur, cruise circumference, and index of proportional and well fit index. It's many information for morphology quality and parametric indexes. Includes in parameters which need for estimate physical development. Criterion of physical development includes also functional quality, functional parameters. It's arterial blood pressure, vital respiratory capacity, breathing capacity, another name, dynamometry, pulse rate, and respiratory rate. All these parameters includes in criterions of physical development. All these parameters need for estimate normal, abnormal physical development on really child. What is the factors of affecting physical growth? No, first factors, it's genetic factors. You studied its factors when you study previous subjects such as biology, medical biology. You remember about its factors, no? Second factors affecting physical growth, it's growth potential. The smaller is child at birth, the smaller the child is likely to be in later years. The larger at birth, the larger child is likely to be later. Growth potential, and from birth we can estimate it when we check parameters of body children's at birth. The third factor it's nutrition. Nutrition is a very important part, very important factors uh, for good physical growth. The first factor is metabolic disorder. When we have a serious chronic process with disorder of main functional system, no, for example, here includes renal acidosis and glycogen storage development retard growth. If we have a serious chronic diseases and change metabolism and metabolic disorder, we have potential factor affecting physical growth. It's also according to chronic infections. The 6 severe chronic diseases of heart, the 6 factor affecting physical growth. Severe chronic diseases of heart includes congenital heart diseases, for example, lungs, asthma or bronchiectasis, chronic pneumonia, liver, if we have cirrhosis of liver, cirrhosis, it's very serious situation. Chronic disease of kidneys with renal insufficiency or renal failure, or pancreas, diabetes mellitus. These diseases retard growth. All these diseases, when it start in early age, may be very flu to physical growth and retard growth. All babies with these chronic diseases have all babies of chronic disease have low parameters of physical growth. Seven factor affecting physical growth is in endocrine disorder. Growth is regulated by complex mechanisms such as growth hormone, somatotropin and somatinib. Thyroid deficiency also retards the growth in height. In really a very important part of any process of growth is endocrine factors. Such as result, we have on photos on right photos you can see a baby with thyroid deficiency just start from after birth. It have a specific face of child with big tongue, with edema of upper part of no, it's maybe total edema, but not very high stage. 8 factors affecting the physical growth. It's mental deficiency. Mental deficiency now present in many situations. This is often associated with defective physical growth, which may be extreme. mental deficiency includes disorder of feeding such as result we have defective physical growth. And sometimes we have unknown factors, непонятные факторы in Russian, да? Unknown factors, it's very rare form of farmism and wormism, да? And if we have situation disorder of growth, but all previous factors don't include with normal parameters of endocrine, without chronial deficiency, without mental deficiency. If all of these factors not present, we have unknown factors. Factors of environment and social factors. Many factors include flew to physical growth in early age, especially, and started in very early age in inter-uterine periods during pregnancy, or nutrition of mother during pregnancy and lactation. Very important factors for which need to use when estimate physical development disorder. Nutrition of child during early age. Sometimes we have factors such as regime or regime of the sleep and rest. And when this disorder may be disorder of physical development. Unsatisfactory socioeconomic factors. Right? Not secret for anyone that in countries with low social economic situation with bad social economic factors, many children have disorder of physical development. It's maybe retard. Physical training, one of the most important factors for normal physical development. Physical training must be present in every day, in any situation, and start in early age, such as toddler time, from 1 to 3 years old. In preschool periods, you remember preschool periods, it's from 4 to 6 years old. And in school periods, a very important part of factors which flew to physical development. Prophylaxis actions, it's harder in swimming, it's specific factors, actions, specific actions with good factors for physical development. And natural factors. No, natural factors includes comfort of climate, comfort of surrounding, especially without any problems with different poisonous and another ecological problem, natural factors. The method of estimate physical growth and development. We have different variant compared with formula results. Formula results we have specific empirical formulas for calculate how must be in different age, height, weight, and another parameters of body. Second method, it calculate different indexes, such as index mass of body, for example. Yeah? And third method, it's most often situation now, it's main method of estimation physical development in the whole world. It's method of percentiles. And after some time, we return to this method. It's now you can see formulas for calculated of different parameters of body, what must be in normal, да? In different age. The first is fetus, да? Intrauteral periods of childhood. The height of fetus, you can see the first 5 lunar months. It's formula for height of fetus. When n it's months, the months just lunar months, that 28 days. No, for example, fetus in 4 months has a height 4 in 2 degree is nearly 16 centimeters. From first lunar month's height of weight, it's another formula. 5 on n, when n is number of lunar months. For example, fetus in 6 months has height 5 on 6 and it's nearly 30 centimeters. When baby born, the height of maturity of newborn in normal, it's body between 46 to 56 centimeter. In average, nearly 50 to 52 centimeters. The boys has average height 50.7 centimeters. The girls has average height slightly low 40.2 centimeters. The premature of newborn has weight lower than 45 centimeters. You must remember about it. It's one of the most parameters, most important parameters of preterm newborn. The premature of newborn has weight lower than 45 centimeters. The later body emission with high meters. High meters in different age, different variant. The first auxinometer adult chart, it's specific plan, when different near the wall, we can see specific graffiti. For newborn, it's very it must be change of little body in horizontal position, such as results. It's maybe another variance, such as here on this desk we can put our child and with centimeters parameters. How change of height during first year's life? It's fixing you this information. You must. Would you like to fix an information, because in practice classes you have tasks about baby's feeding and physical development, and these parameters you can use for calculate um, parameters of body of child according to some month's age. During the first quarter of first year's life, baby every month increase in average, increase 3 centimeters per month. In summary, first quarter at from 1 to 3 months years old. The third quarter from 4 to 6 months years old. Every month baby increase height on 2.5 centimeters. In summary, for 3 months, for this quarter of first year's life, in summary, 7.5 centimeters. The third quarter, from 7 to 9 months, every month, height of body of child increase on 2 centimeters. And first quarter, it's maybe deviation from 1.5 or maybe 1 centimeters per month, from 10 to 12 months years old. In summary, for first year's life, our child formula, the height from or weight of body at birth in average 50 centimeters plus 25 in summary for during first year's life at, and such as result in average we have height of body 75 centimeters in the end of the first year's life. Formula of calculating of height in children still 4 years and older than 4 years. Till 4 years, it's late in centimeters, and 100 minus 8 in, oh, you can see this formula on this variant. And when we have n, it's number of year, not months. It's number of year. Height of is doubled to 2 years. Doubled in 2 times increase up to 4 years after birth. The height increase in 3 times after birth, nearly to 11, from 11 to 14 years old. Sometimes we have a very specific process such as acceleration of height. Acceleration of height, it's situation when we have a different speed of increasing of height. you must remember in different age we have different increasing of parameters of body and especially for height. And in some time it's low speed, in another situation increase this speed. And you remember first acceleration of height and present at boys, for boys, in 5 for girls for in 6 7 years. After the rate of growth slow to minimum. For boys it's situation 9.5 in average 9.5 years. For girl it's situation with minimum speed of growth, it's 8.5 years. Second acceleration, it's according to our puberty period, when all our process uh, in complex with our hormone mm, acceleration, and such a result in girls in uh, 9.5 8.5 to 10 till 11.5 years. A second acceleration start between these periods. And for boys, second acceleration maybe later than girls in 13.5 to 15.5 years. If you remember your study in school, you remember from several classes when um, girls have more height than boys, and just after 1 year, 1 to maximum 2 years in 8 or maybe 9 classes, it's situation just opposite. It's situation about acceleration. The cessation of growth, when we have cessation of growth of boys into 17.75 in average, and girls to 16.25 years. Now we continue about mass of body or weight. The mass of maturity of newborn, full-term newborn, more than 2,500 grams. The mean between, no, the average between 3,200 to 3,500 grams. The fetus with mass of body more than from 3,500 grams to 4,000 grams named large fetus. More 4,200 grams giant fetus. The premature newborn has weight lower than 2,500 grams. It's nappy baby's balance when we have its mechanic baby's balance. We have electronic version. During practice classes you can see it at our department. Now after delivery there is a loss of weight. It's physiological loss of weight at birth. Babies commonly lose 5 to 7% of their body weight in the first 2-3 days after birth. It's maybe according to loss of water after start of breathing, after meconium primary stool outside also, and first several days the volume of feeding and volume of water input in these periods, especially first 2 days, first 2-3 days after birth, low, and such as result we have loss of body. It's really just only in these periods it's physiology. In other periods it's pathology situation. This no, it's repeat once more. Respiration, gastrointestinal tract, meconium, primary stool, kidney, urine, little quantity of mother's milk, colostrum, just only colostrum, and act. It's the main reason of physiological loss of weight at birth. You can see. Full-term babies usually regain their birth weight. Two variants. They regain weight within 7 to 10 days. It's ideal type. It's return to regain their birth weight. 25 children's has this variant. Regain weight within 12 or 15 days. It's slow in time. 75 children return to their birth weight just only to 12 15 days. What formulas you can use when we calculate parameters of mass of body in different age? From 1 to 6 months, you can see this formula on slides. No, for example, baby 4 months has mass, if we use mass at birth and average 3000 grams plus 80 grams per every month, and such as result in calculate baby in 4 months with mass of body at birth 3000 grams must have weight nearly 6200 grams. It's orange situation, huh? Formulas of mass calculating from 7 to 12 months. It's also includes previous formula because baby for 7 or 8 months age till to 6 months. The previous formula includes, you can see it in calculated. Every month after 6 months, from 7 months and older, every month in average mass of body increase every month 400 grams. And you can see for baby with No, тут for we have short mistake, да? Baby for 7 months has mass of body 3000 grams. Its parameters at birth 800 on 6. It increase during first 6 months after birth, and 400 grams. It increase mass of body during 7 months. And such as result, in 7 months, we have baby's mass of body in average 8,200 grams. Formula of calculating weight and children older than 1 year from 2 to 10 years old, mass of body it's 10 kilograms 10 kilograms at mass of body nearly first year's life, plus 2 in n, when n is the number of year. Such as result, baby 6 year has a mass of body 10 plus 2 on 6 year, да? It's result 22 plus 10 kilogram, 12 plus 10 kilogram. Such as result, in 6 year, it average 22 kilograms. Formula of calculating of weight in children's older 10 years, older 10 years, the older 1 year start from 2 to 10 years and older than 10 years. We have another formula when includes these parameters, and you can see the baby of 12 years old has a mass of body nearly 38 kilograms. Okay, now we have a short interval. You can take a cup of tea, and after short interval, after 10 minutes, we continue. Сейчас. Okay, let's continue our lectures. I hope you have a short rest. Um, Parameters of body of full-term newborn. It's very important information for understanding physical development and situation condition of health of newborn. Head circumference at 34 to 36 centimeters. The doctors will take in measurement of points where the head is largest circumference measured with tape. Take it point on frontal tuber above the ears and around the head to the back when the neck meet the cranium. The head circumference of newborn, it's repeat once more, it's 34 to 36 centimeters. In 6 months of head circumference amount in average 43 centimeters, and formula of calculated of head circumference till to 6 months, it's 46 centimeters minus 1.5 to in number of months. For example, baby of 4 months, head circumference 45 minus 1.5 and such as result 40 centimeters. Older than 6 months, head circumference increase and every month only 0.5 centimeters, and we have special formula for calculating these. For example, for baby 9 months, head circumference knowledge must be 44.5 centimeters. Formula of head circumference calculating from 1 to 4 years. It's elder children's. It's amount 50 minus, no, you can see this formula, and for example, for child of 4 years old, head circumference, it's nearly 48 centimeters. Formula of head circumference calculating older children, then from 5 to 12 years old. You can see this formula and the example children of 8 years old, head circumference in average nearly 45 or 52 centimeters. The key points of head circumference to 1 years nearly 46 to 47 centimeters, to 5 years 50 centimeters, to 10 years 55 centimeters. It's main key point of head circumference at different age. The chest circumference of newborn lower than the head circumference. It's nearly 32 to 34 centimeters. To 4 months, the head circumference and chest circumference the same to 4 months. Formula of chest circumference calculated till 6 months present here, and you can see, for example, that baby 3 months years old, chest circumference, it's maybe nearly 39 centimeters. Formula of chest circumference calculating older 6 months. This formula you can see And also for baby 8 months years old, chest circumference in average nearly 46 centimeters. 46 centimeters. Formula of chest circumference calculating from 1 to 10 years old. You can see in this slide. No, for example, child 8 years old has a chest circumference nearly 60 centimeters. For older than 10 years old, chest circumference formula here, and for example, child 12 years old has chest circumference nearly 69 centimeters. Key points of chest circumference. To the first years, chest circumference nearly 47 to 48 centimeters. To 5 years, 55 centimeters. To 10 years, 63 centimeters. And pay attention these parameters just after 4 months, chest circumference more than head circumference. Body proportion of children, the main parameters of this proportion of children is mass, height, coefficient of indexes for maturity infant. When we divide to mass to height, normal of newborn is parameter is 55 to 65, and baby with hypertrophy has index less than 55. If more than 65, it's also bad situation. We have paratrophy. Index proportion of Ehresmann by Ehresmann, it's calculated. It's also different age, different position. No, now its index is not used in real calculated. Index well-fit by Chulitskaya. It's also indexes we use in several years ago. It's when we have that method of percentiles. We use these parameters: index Chulitskaya, Ehresmann, and another. Method of percentiles. It's very often the main method of estimate physical development, especially in the end, in the age older than 1 year old. All parameters in percentiles table or percentiles graphics includes mean normal result. This is 15th percentile and percentile or normal 2 deviation of normal position from 25 to 75 percentiles, low average at between 10 to 25 percentiles, the 75 to 90 percentiles, it's about or higher than average, and from 3 to 10 percentiles, low physician development, and over than 90 to 97 percentiles is higher physical development. Less than 30 percentiles and higher than 97 percentiles. It's pathology endocrine. Now you can see it on real graphics. But it's graphics of percentiles. We have different color of points. On this graphic we can found on different age. Then we have take age of patient, found parameters of body. Now it's in inch or maybe centimeters, and weight also present here for weight and for uh, height and weight. When we have a red color, no, slightly red color, it's parameters of overage, of body. When we have green color, it's the field for low or high parameters, but in lower than average and higher than average. And if parameters of body present in more highest situation, more than upper linear of graphics without color, it need to more attention, understanding what happened with patient. It's must be warning for most often endocrine or maybe another problems. Its parameters from birth to 36 months of body for boys, and also this from 2 to 20 years also for boys. It's graphics and table present for any age of child during childhood. And now its main method for physical development estimation, and this. No, repeat once more about reasons or causes of pathology of physical development. The first main groups, it's endocrine. Most often it's growth hormone deficiency. Second, genetic syndromes, Down, Turner, Marfan syndromes. It's maybe a different variant. For Down, more correctly, a low physical development. For Marfan syndromes, uh, uh, specific situation with high physical development, height increase, especially. Chronic diseases, gastrointestinal tract, heart diseases, hepatitis. Remember that? Metabolic diseases, phenylketonuria, such as situation where we have in early age. Skeletal diseases, bone dysplasias, rickets, also when present situation with disorder of growth zone of bones, it's a situation with not normal process on height increase. Nutrition, malnutrition such as variants. Constitutional slow and tall growth. Constitutional slow, it's you remember about in some family present situation, it's more correct with genetic factors, but not syndromes, not pathology. When parents have experience have a low height, in more often situation, children also have low height. psychological problems such as result also when we have in puberty situation some situation problem with eating feeding disorder. Chronic exogenous intoxication, it's fluoride, for example, lead. Ну и full-term newborn we remember about parameters of physiological parameters of physical development such as pulse rate, breath rate, the heart rate of newborn, for example, must be more than 100 per minute. In average, 120 to 140 per minute. Respiratory rates in newborn more than 40 per minute. Cry of the nature of normal newborn spends to 80% time of in sleeping. Thermogenesis is not stable. And also when we check newborn physical development, we also check specific reflexes of newborn. It's according also to physical development. Reflective action of newborn child includes sucking reflexes, founding reflexes, reflexes of automatic going, grasp reflexes. You can see it when the doctors give newborn the finger, and, fix it finger, newborn fixes it finger. It's more of reflex. No, it's more correct for newborn topic when you study it in another time. Okay, today, thank you for attention. All another questions you can ask your teacher during practice classes, and during our lectures we just only fix main information about different parameters, how calculate different parameters of body for estimate normal or abnormal physical development in child in different age, and just after birth and another days and all the time. Thank you for your attention. Good luck and be healthy. Don't worry. Thank you.